Hey doc, you won't believe how fast dentistry can ruin your body. How's your upper back? Or here's another good one for you. How's your shoulder? If you answered fine to both those questions, then at this point you're ahead of the game. But here's the shocking truth. According to a literature review by Ben Skittity et al., 93% of dentists will experience some sort of musculoskeletal complaint in their dental career. The same review takes that a step further and also suggests that 30% of dentists end up experiencing chronic musculoskeletal problems. But it's not just the pain. These physical issues often lead to burnout, reduced productivity at work, and, unfortunately, early retirements. So you might be wondering, what are the main culprits of these musculoskeletal problems? Number 1, static postures that strain our back and neck. Awkward twisting to see that number 2 that you're extracting. Repetitive movements that wear down your wrists and your shoulders. Worst of all, these injuries when they're small often go unnoticed until they become a chronic problem and are very challenging to treat. But the good news is that there are things we can start doing today to prevent it in us. Number 1, many dentists are now wearing dental loops, which allows for proper ergonomic positioning during surgery, and this has certainly resulted in far less upper back, lower neck problems. But I think we can now take this a step further by incorporating some physical therapy, exercise, training into our daily routines. So I thought this would be the perfect time to do a deep dive in the literature and see what we can do as dentists to prevent these musculoskeletal disorders from even happening. According to a review article from the Journal of Clinical and Diagnostic Research from 2014, it states that dentists should focus on both aerobic exercises to strengthen our muscles, as well as stretching exercises to extend muscles that were held in constant contraction while at work. As always, there's a lot to discuss, so let's jump right into some suggested workouts and exercises. Just like a race car driver doesn't start their engine and then punch the gas, we shouldn't do that either. The literature reviews suggest that we should start our days with some light aerobic exercise. The best thing that they suggested was a 15-minute light walk. A light walk really has 2 benefits. It gets you warmed up, and it also helps stave off heart disease. Recently, the American Heart Association suggested that we should all do 75 minutes of walking each week to prevent heart disease. This is absolutely something that can be done at your office, whether that's inside or outside the office, you pick. The literature review next suggests that we'd move on to some sort of more intense aerobic exercise. They suggested biking, swimming, running, circuit weightlifting, some sort of more aerobic, but definitely more strenuous type exercise. The review states that dentists need better blood flow to our muscles to prevent the fatigue and injuries that they have, and the best way to bring blood flow to a muscle is to pump it. Personally, I love hitting a 30-minute weightlifting circuit. It's a tremendous way to get the blood flow flowing everywhere. The only downside, however, being that this is certainly going to be more challenging to get done at your office. If you don't have access to weights or a gym, then do something cheap. Go for a run. It'll be free. This is something you can do at lunch or right after work. So after this big aerobic workout, you already did the walking, now you did the more intense cardio. The next thing you're going to do is start to reduce the tension in our muscles by stretching. So this should be a 5 to 10 minute activity, and it should be pretty easy. Just think, this 5 to 10 minute activity of stretching could prevent you from a career-ending injury. So not something just to glaze over. So we should loosen them by doing these 7 stretches. Number 1, tucked chin. Sit upright. Gently tuck your chin towards your chest until you feel a stretch in your neck. Number 2, upper trapezius, then scalene stretches. Bend your neck to the side and apply light pressure with your hand. Bend your head to the other side. Apply pressure the other direction. That'll stretch the scalene. Do both sides each way. Pec major stretch. Stand facing the corner of a wall, 2 feet away with it, with your arms against the wall. Lean into the wall, bending at your knees until you feel a stretch just in front of your shoulders. Number 4, Upic thoracic extension. Sit in your chair and place both hands behind your head. Inhale and take both elbows backwards. Number 5, lateral trunk stretching. Sit in the chair and bend to one side with the opposite hand raised way overhead. Number 6, a hand stretch. Extend your fingers and gently pull them back with your other hand. Last but not least, number 7, the hamstring stretch. Sit and stretch toward just one outstretched leg. Switch legs. Each stretch should take you just a few seconds, so if you can't build a 10-minute window to get them all done in the morning, then consider sprinkling them in for micro breaks between patient appointments as well. Lastly, once you're nice and stretched out, consider combating that muscle imbalance with some strengthening exercises. So most of these exercises can definitely be done in your office, and they really do not require much equipment. So keep following along for more things that you can do. Number 1, tuck chin. So while lying on your back, move the chin towards the chest without lifting your head. Number 2, shoulder retractor strengthening. Lie on your belly. Rest the upper arm on the table with your shoulder at approximately 90 degrees and flex the elbow with the forearm over the edge of the table. Lift the arms off the couch, maintaining the elbows in the same position until the shoulder blades come close to each other. If you need some help, add some small weight in your hand. Number 3, shoulder rotator strengthening. Same positioning as the previous exercise. Instead of lifting the arms, rotate the forearms first in one direction and then do the other. Number 4, shoulder depressor strengthening. Sit on a hard surface and push the body upwards with the help of the hands. Number 5, serratus anterior strengthening. Lie on your back and lift the arm to 90 degrees with your elbow straight. Raise the shoulder off the table. Feel free to add a half kilogram weight in each hand for progression. Number 6, bridging. Lie on your back. Lift your hips and hold the position for 10 seconds. Number 7, shoulder retractions. Lie face down and lift your arms off a table while squeezing your shoulder blades together. Multi-fidus training. First, lift one hand and opposite leg. Look at the hand. Repeat with the other side. Erector muscle strengthening. Lie on your belly and lift the trunk on your elbows. Quadricep strengthening. Sit on a chair and lift the leg, keeping the knee straight. Hand strengthening. Squeeze a soft ball or putty. By focusing on starting with 8 to 12 reps per set and completing 2 or 3 sets per exercise each day, you can definitely help stave off some musculoskeletal problems. Personally, I can complete all those repetitions and sets in approximately 15 minutes. I do this many days during my lunch break. I find it's a great way to stretch out after the morning and getting it done before my afternoon food coma hits. So if you're a dentist, your career doesn't have to break your body. Start doing these exercises daily, and I bet you'll start to feel better starting tomorrow. If you found this information useful, please subscribe so that you don't miss out on future videos with actionable advice tailored to dentists just like this one. In the meantime, and as always, stay drilling, my friends.